Magnetic resonance imaging of the prostate, or MRI, is increasingly being utilized in various clinical scenarios for the prostate and giving men more information to help guide them in their decision-making. Today, we have radiologist Dr. Rajan Gupta from Duke University to tell you all you need to know about prostate MRI. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is my pleasure to introduce Dr. Rajan Gupta joining us today on the Prostate Health Podcast. Dr. Gupta is Division Chief of Abdominal Imaging at Duke University and will be the first radiologist that we've had on the podcast. He is also Director of Imaging for the newly created Duke Cancer Institute Center for Prostate and Urologic Cancers. He has been a prolific and productive researcher in the area of genitourinary oncology. He is a nationally recognized expert in prostate MRI, and we are very fortunate to have him with us today. Dr. Gupta, welcome to the Prostate Health Podcast.
Thank you so much. It's a pleasure to be here.
So, Dr. Gupta, first of all, tell our listeners, what is MRI and how does it work?
Sure, absolutely. So MRI is an imaging technology that we use that allows us to take a much better look at the prostate gland. So many listeners may be familiar with the concept of CT scans or ultrasound or MRI. And so MRIs require no radiation to get to the answers that we need as compared to CT scans, which do require radiation. One of the other big advantages of MRI is it gives us very high resolution pictures of glands like the prostate to really differentiate between normal tissue and abnormal tissue.
So how long have we been using MRI to look at the prostate?
So it's an interesting question, actually. The first time that MRI was really described for use in the prostate gland was actually in the early 1980s. But where it really took off is when the technology's improved in the past, I'd say 10 to 15 years. And in that time period, what's really happened is the technology of the scanners has improved, the technology of the coils used to obtain the images has improved, and also our understanding of the prostate gland and what it appears on MRI has really improved as well. So the combination of all those things has really led to MRI taking off in the past, again, 10, 15, 20 years at the most, even though it's been described all the way back since in the early 1980s.
So, Dr. Gupta, what are some of the different scenarios where a prostate MRI might be useful?
So the best thing about prostate MRI is it continues to increase in utilization. When we first started doing prostate MRI, I'd say about 10 or 12 years ago, we were really only doing so in really advanced cases. Situations where the prostate cancer had already involved the seminal vesicles, situations where the prostate cancer had already gone outside the gland. But as we've gotten better and more precise at the diagnosis of prostate cancer on imaging, specifically with MRI, what we are now able to do with prostate MRI is actually detect which cancers are clinically significant cancers and which cancers are actually more indolent cancers, which cancers could potentially be treated using prostatectomy or radiation, and which cancers actually can fall under the category of active surveillance, where we would actually watch them and determine if there's any progression. So one of the great things about prostate MRI is that its utilization has increased and the number of scenarios that we can use it for has really changed.
And you'd kind of mentioned the role for active surveillance. How about kind of the role for hearing more and something that I've utilized in my practice, helping guide targeted biopsies or the fusion biopsy?
Yeah, it's a great question. So as I mentioned, as we think about ultrasound has traditionally been the number one modality inside of prostate cancer or prostate imaging for urologists, because that's really what you as a urologist would use to do a biopsy. The goal of the MRI in these particular scenarios is to, number one, get an understanding of what's going on in the gland. Is there any prostatitis? Are there any stromal nodules? Things of that nature. But more importantly, are there any suspicious areas that need to be biopsied? When we do the MRI, what we're able to actually do then is mark and segment that prostate gland as well as those potential lesions that are worrisome. Use a 3D mapping tool to actually overlay that on the real-time ultrasound images that are done, and then allow you as a urologist to really focally target those areas that are most suspicious on the MRI. So MRI has increased our ability to visualize those suspicious areas, characterize those suspicious areas, but I think really, really importantly, target those suspicious areas on biopsy. And I think that's one of the really huge, huge areas where MRI has grown and has really entered into the community setting as well.
Definitely some great information so far on prostate MRI. We're going to take a quick break here. We'll be right back with Dr. Gupta. Thanks again for joining us today on the Prostate Health Podcast. If you're enjoying the show today, make sure you visit my podcast website at www.prostatehealthpodcast.com. There you can find show notes to all our episodes. You can also click on our resources tab, where you can find links to our trusted partners of the podcast, as well as links to books, resources, and products, all of which can help in your journey with either an enlarged prostate or prostate cancer. You can also sign up to receive my free What to Expect guide, which includes checklists of what you need to bring and how to prepare, including what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, or prostate cancer consultation. Sign up for the free guide on the homepage of www.prostatehealthpodcast.com or access this guide directly at www.prostatehealthpodcast.com/clinic. So a common question that I get from patients, particularly in men that have not had a prior prostate biopsy, is, okay, so if I get an MRI and it comes back with no suspicious lesions, do I really need a prostate biopsy?
So that's a great question. So what I tell all of our patients is that prostate MRI is not intended to replace biopsy. It's intended to complement the biopsy. So what I will tell you is that even in the best case scenarios, what we think is that there's probably about a 10% false negative rate with prostate MRI, which basically means that if there are suspicious things clinically that your urologist suspects, we still recommend that you get a biopsy for that. However, the ability to rule out clinically significant cancer, which is really the cancer that you need to treat in an active way, is very, very good. Our ability to diagnose those cancers is very, very good and very, very high on prostate MRI. So many places will say if you have no other suspicious factors, no suspicious PSA trajectories, things of that nature, and you have a negative MRI with no focal target lesions, they will actually not do a biopsy. Again, it's a very individual decision between you and your urologist, but at the same time, the concept is there that MRI is getting to the point now where we can really rule out clinically significant cancer at a very, very high level, especially when done in the right hands.
And we kind of had a bit of a discussion about this kind of in our pre-podcast chat in terms of, in my, this is something that I've been doing with the fusion MRI prostate biopsies. And, in our practice, it's been more so in patients that have already had a negative biopsy. And somewhat we talked about that being driven by the payers in what insurance, often some of the insurances are not covering the MRI in somebody that has not had a previous prostate biopsy. But is this something that as we get kind of further along and learn more about the MRI and that this is going to be changing as we get going?
I certainly hope so. I mean, we in the US have started to see very educated patients now come to us and say, why should I get a biopsy before I get imaging? And that's a really reasonable question, and a question that I think we as prostate cancer experts have to answer. And also that we as prostate cancer advocates have to work with the insurance companies to start coming with a better solution for. Prostate cancer is one of the very few, if not the only cancer that we will actually biopsy you before taking a look at your actual gland. And that is a very tough thing to really rationalize, especially given the fact that we know that even in the best hands, the transrectal ultrasound-guided biopsy has a false negative rate that can reach somewhere in the range of 40%. So in Europe already, there's movements called MRI First, for example, which are really geared to say, use MRI as not a screening tool like mammography, but really a means by which patients with elevated PSAs can get imaging first in favor of targeted biopsies, as opposed to the traditional 12-core biopsies, which just sample the entire gland. So I think we are getting to those points. I think that, again, as advocates for prostate cancer patients, we need to be thinking about how do we convince insurance companies that appropriately utilized MRI early stages can really make a big difference in treatment decisions for those patients.
Well, thank you for that. Okay, so for our listeners, say their urologist has now ordered an MRI of the prostate. How should they prepare for this test, or what can they expect?
Sure. So an MRI basically usually takes somewhere in the range of 30 to 45 minutes. It obviously requires you to go into a MRI tube and requires you to have no metal inside of your body. So there's a pretty robust set of screening programs that go through first to make sure that you are an appropriate candidate for MRI. The next thing you'll do is when you do go into the scanner, you're taken in by a technologist. They generally will put some headphones on you because it can be pretty loud inside of that. That's due to the nature of the way the MRI images are obtained. Depending on the facility that you're at, they put in endorectal coil to improve the resolution of the examination, or they may place a coil on top of your belly to add some additional signal to the area that they're scanning. Again, you'll go inside that scanner for about 30 to 45 minutes, and then those images will be produced. Many times you will be given contrast. So gadolinium-based contrast, that is the stuff that they will inject through your IV, and that allows us to see the enhancement of the prostate and any suspicious enhancement inside the prostate gland. Once the examination is complete, the examination will be routed to a radiologist who will then take time to interpret those images, generally get those reports back to your physician, and then your physician will share those results with you. Depending on the facility, there is also the capacity of doing the 3D markings. So for example, here at Duke, every single case that we do prostate MRI for will get a prostate segmentation as well as lesion marking. So should the desire be there for the urologist to do a fusion biopsy, all of that information is ready to go.
Well, that's certainly excellent information. So in summary, Dr. Gupta, you've really given an excellent review today on prostate MRI and its utilization in various clinical scenarios, as it is giving men more information to help guide them in their decision-making. Dr. Gupta, any final thoughts for our listeners today?
I really applaud you, Garrett, for bringing this topic up. I think a lot of people have questions about prostate MRI, and we're finding, as we did in our pre-podcast chat, that our listeners and our patients are becoming very highly educated on advanced imaging techniques, et cetera. So I'd encourage all of your listeners that if they are interested in prostate MRI, there's literature out there on the web to take a look at. Speak to your urologist about the ability to do an MRI, and specifically a high-quality multi-parametric MRI that involves T2-weighted imaging, diffusion-weighted imaging, and contrast-enhanced imaging. Not all prostate MRI is created equal, so it's important that you go to a center that has a lot of experience doing prostate MRI and works very closely with the urologist. Prostate cancer is increasingly becoming essentially multidisciplinary in the sense that there's really no individual specialty that works without the others. And I can tell you that we feel very strongly that the prostate MRI is part of the armamentarium of diagnostic tests for prostate cancer, and we really think that it adds value. Pretty much nobody goes to the OR here at Duke without a prostate MRI, and we feel really strongly that we can help patients.
Dr. Gupta, it was certainly a joy getting to chat with you today on the Prostate Health Podcast. You've definitely given a lot of valuable information today for our listeners. Thank you again.
And thank you for doing this podcast. I think it's super important.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.